In this video we're going to talk about cystic fibrosis. Cystic fibrosis is a hereditary disease, and it basically is a disease that involves abnormal secretions. And abnormal secretions are really involving any gland that secretes fluids into a duct. So any exocrine gland, basically. And these thick secretions eventually clog these ducts and cause a lot of problems. So let's get started, and before I get into the symptoms and the diagnosis and treatment, let's explain what is actually happening. So this is a diagram where I'm drawing the skin here. So this is the epidermis, and a little bit further down is the dermis. This here is the sweat duct lumen, okay, and this is the skin surface up here. And we all know that what comes out of this duct? Well, water comes out. And then along the lining of this duct are cells, and that's what these represent, and these are epithelial cells. Now what I'm going to do is I'm going to take a section right here, and I'm going to blow it up over here. I'm going to draw it much bigger. This here is the duct, okay, and this here is one cell, one epithelial cell. All right. Now that we have this drawn, I can talk about what happens in cystic fibrosis. In cystic fibrosis, you have this protein right here, okay? And this protein has a special name. It's called CFTR, and CFTR stands for cystic fibrosis transmembrane conductance regulator. It's a protein. And what is it? What does it do? Well, it is a chloride channel. What does it mean, chloride channel? Well, the chloride goes back into the cell via this channel. All right. Now, there's another channel that exists in the same cell. It's called a sodium channel. And the sodium channel, as you can imagine from the name of the channel, it transports sodium. And sodium goes out into the duct. So sodium comes out, chloride goes back into the cell. Great. Now, what happens in cystic fibrosis? Well, in cystic fibrosis, I'll draw the same diagram. This is the duct, okay? And we'll just draw one cell, one epithelial cell. Well, in cystic fibrosis, that CFTR protein, chloride channel that is responsible for chloride transport, is either defective or absent. So therefore, the chloride doesn't go back into the cell. The chloride just gets secreted out along with the water. Okay? And then what happens to the sodium? Well, interestingly, the sodium channel is perfectly normal in cystic fibrosis. So the sodium also goes out, just like it would normally. Well, look at what we have here. We have sodium and chloride together, and that's salt. Salty. Salty taste of the sweat. That's what's happening. I hope this makes sense. I mean, this is a very kind of a basic way of describing this, because the pathophysiology of the CFTR is very complex, and I just wanted to give a brief introduction of what this is all about. Now, this of course causes major problems because it causes secretions here out of any duct really that is involved in this kind of a process to have secretions that are what? That are very, very thick, okay, sticky, and highly viscous. high viscosity. And that is really the major issue that's happening here. I'll draw a little diagram to kind of illustrate what would happen in just one of the areas that cystic fibrosis affects. So this is an airway that I'm drawing. Okay, this is an airway. Well, this is a normal airway. You see how big the space is. Now what happens in cystic fibrosis? Well, these abnormal, thick, sticky, highly viscous secretions clog the airway. Do you see what's happening? And do you see how the passages are getting narrower because of all this? This similar type of process happens in ducts all over the body, in any type of exocrine gland. And those glands include the lung, pancreas, intestines, and other things as well, like reproductive organs. But we're going to concentrate just on really these two here, the lung and the pancreas, when I talk about symptoms and treatment. Okay, so let's get into that. Let's get into the symptoms. Well, when you talk about symptoms, it's probably best to kind of break this up into lung, pancreas, and intestines. Otherwise, it'll be too confusing. All right. So let's do that. Okay. Well, I'm going to start by talking about symptoms in kind of a chronological order, meaning what's the first thing to present, and then kind of go from there. Well, when a child is born, a newborn, the very first thing that can happen is something that involves the intestines, and it's called meconium ileus. Okay? Meconium ileus, meconium is just the first stool that a baby has. And the term meconium ileus just simply means that the meconium is obstructed in the large intestine, and as a result, it's not passing. So the child may not have a bowel movement for 1 to 2 days after birth. So that's the first thing that can happen. Now let's keep going chronologically. The next thing that can happen is in the lungs, something called mucus plugging. Mucus plugging. Well, that diagram I drew earlier kind of illustrates what that means, is that the airways get clogged with this thicky stick secretion that's the main contributing factor to the pathology of this disease. And that mucus plugging is not without its problems. It causes bacterial infection, and it can cause inflammation as well. And that is a chronic disorder, chronic symptomatology that cystic fibrosis patients have to live with. Other symptoms that can happen that are related to the lung include coughing, wheezing, and respiratory tract infections. So those are the symptoms associated with the lung. Now let's talk about the pancreas. Well, the pancreas normally secretes digestive enzymes, and those digestive enzymes go into the intestine. But in a person with cystic fibrosis, these enzymes are not able to reach the intestine because of the blockage of the ducts that we illustrated earlier. So as a result, you get poor absorption of the fats and the proteins and the vitamins that the digestive enzymes of the pancreas normally are responsible or aid in absorbing. This can also eventually lead to poor growth in the child and nutritional deficiencies. And also, as you all know, the pancreas is responsible for producing insulin, and when the pancreas becomes scarred because of cystic fibrosis, it can no longer produce enough insulin, and that leads to diabetes. So these are the symptoms that are involved in cystic fibrosis. Let's just keep going here. There's a few more that I wanted to talk about. Let's just keep going here with the pancreas. The nutritional deficiencies can also lead to poor weight gain. That's a big one, actually. Very, very big one. And another thing that a child can develop because of the pancreatic problem is the bulky, foul-smelling stools, because the fats that are normally absorbed are not being absorbed, and they're just being secreted along with the stool. Bulky, foul-smelling stools. Okay. Well, that's a bit about the symptoms. There's one more thing I'd like to mention before I jump into the diagnosis, is something that I see a lot on licensing exams: rectal prolapse. This is a common, as many as 20% of infants can have this. It just means the lining of the rectum has protruded through the anus. I've seen licensing exams in which they just show a picture of a rectal prolapse and they ask you what's the diagnosis. So I wanted to mention that. Well, now let's get into the diagnosis. How do you diagnose this? How do you figure this out? Well, it's a famous test, sweat chloride test. As I mentioned early in the video, chloride concentration in the secretions is much higher than a normal person because of the chloride not being able to get reabsorbed into the cells. It's just being kicked out into the ducts and eventually into the secretions. And it's going to be high. I think it's 60 milliequivalents per liter. Greater than 60 milliequivalents per liter is what you would have in a cystic fibrosis patient. Very, very diagnostic. Well, now finally we get to the treatment. And just like I did with the symptoms, I'm going to break it up into lung and pancreas. Okay. Well, for lung, the first thing you want to make sure is that you immunize the child. Immunizations, because people with cystic fibrosis, children with cystic fibrosis, can develop respiratory infections which such as Haemophilus, influenza, measles, so you want to make sure you immunize them to all those things. The next thing that's part of the treatment is something called pulmonary toilet. Now, what is that? That's referring to airway clearance techniques where you use either chest percussion or hand vibration over the chest wall and encourage the patient to cough, and all these are in an attempt to clear these secretions that build up in the airways. The next thing you give is something called a bronchodilator known as albuterol, and this is to open up those airways that are clogged with these thick secretions. The next thing you give is a mucolytic. Mucolytic, by definition, is something that breaks up the mucus, and the famous one that they always talk about is Dornase alpha. Dornase alpha. The next thing that you give in the part of the treatment is antibiotics, and in particular there's two. There's azithromycin and there's tobramycin. By far the two most common in cystic fibrosis. And finally, steroids. Steroids are a big component of the treatment because they decrease the inflammation that can occur in the lung. Now let's get to the pancreas. Well, remember we said that the pancreatic enzymes that are normally secreted are not reaching the intestine properly. So you need to give pancreatic enzymes as a supplement to the child, pancreatic enzymes, and they're given as capsules, and the child or the person with cystic fibrosis takes these with meals and snacks. Another thing that you give is fat-soluble vitamins, because if you remember, the person with cystic fibrosis is not able to absorb fats, and fat-soluble vitamins are therefore part of the supplementation. And if you remember, they are A, D, E, and K. These are the vitamins. Finally, to close off the presentation, I'd like to just show a vignette and kind of show you what does a licensing exam question about cystic fibrosis look like. Well, here we go. A 1-year-old child presents with failure to thrive. So there's that poor growth that we talked about. By history, the child was born at the 50th percentile, but has crossed multiple percentile lines despite having a ravenous appetite. The child has more bowel movements per day than other children of the same age. Okay, what is that talking about? That's talking about all the... That's basically discussing, those pancreatic enzymes are not reabsorbing a lot of those nutrients. So they're just going through the system into the stool and causing more bowel movements. The stools often look shiny and have an unusually foul smell. We talked about that. In addition, the child has been treated with multiple courses of antibiotics for persistent wet cough. Those are those infections or recurrent infections that can happen in cystic fibrosis. On measurement, the child is small for age, with weight and length below the 3rd percentile. So that's definitely the poor weight gain and that we discussed. A sweat chloride test is positive. Whoa, that's a big one right there. Most likely diagnosis is, and of course they'd give you 5 choices, and one of them is probably cystic fibrosis. That's a very straightforward cystic fibrosis question, and that's a presentation about cystic fibrosis.